Hi, I'm Dr. Nixon and welcome to Healing Peak Regenerative Medicine's Longevity channel. And today we're going to talk about pain therapies and when to use which therapy. And mostly we're going to talk about cortisone and when to use that and when not to use that. So if you have a painful condition, you'll go see an orthopedist, or you may go see your chiropractor, you may go see many different primary care doctor, that type of thing. But let's say you don't really have a lot of initiation to other types of alternative treatments like acupuncture, chiropractic, that sort of thing. So you go to your primary care doctor and then they may start to treat you with ibuprofen or an over-the-counter pain medication, and when that doesn't go away, they'll send you to an orthopedist. You may or may not get imaging, but most of the time what happens is people end up at an orthopedist's office, which orthopedic is just a doctor that deals with muscle pain and joint pain, primarily joint pain, and their typical treatment or their go-to treatment is cortisone and cortisone injections. And so I just want to talk about that and also how many other options there are out there before you get to that point. And so a cortisone injection is a steroid injection, and a very good friend of mine and colleague has a wonderful analogy. And what she says is, getting a cortisone injection into a joint they don't go into muscles, but into joints is like turning the fire alarm off in a house that's burning down. And it's a beautiful analogy because it's really what's happening. Anytime you get a cortisone injection into your shoulder, hip, elbow, wrist, anything like that, all you're doing is shutting down the response of the body, the immunological response that's telling your body there's something going on there that needs to be looked at or needs to be treated in one way or another. And there are hundreds of ways to treat this without using cortisone. Cortisone is very, very handy to have on board for very specific conditions, probably 10% of the time. But it's used 90% of the time to treat all types of pain conditions because that's really the only tool that a typical standard of care medical practice has, other than over-the-counter medications, which have now shown to destroy the digestive tract and neurology. So there's been some research that's showing early onset dementia related to use of over-the-counter pain medications. So I really try to help people not use those regularly or as a daily treatment for chronic aches and pains. It's much better to get massage, chiropractic, acupuncture, some maintenance things, especially if there's chronic long-term issues. My goal with patients is never to have them on a maintenance type of treatment. It's always to find the solution so that if they come see me again for something, it's not for the same condition we've already treated, as long as we've treated that condition completely. And so what they're commonly using these cortisone treatments for is golfer's elbow, tennis elbow, shoulder rotator cuff tears, tendinitis, those types of things. What it really excels at, cortisone, if you are going to get a cortisone injection, and I just really am with this video trying to help you become your best advocate for yourself when you go into the doctor to get these injections done, or when you go in for an assessment of what they're going to do next for your condition. And what they really work wonderfully for are, in some cases, herniated discs, and in some cases, a tendinitis issue like golfer's elbow or tennis elbow that you have never dealt with before. It's not a chronic recurring issue. It's brand new, you've never had it before, and you're a relatively young person, and sometimes in those situations, getting one cortisone injection will take care of it and it never comes back. They're rare. If I use cortisone, I'm usually using it for a specific disc herniation issue that I need to get that person out of pain so that I can treat them with my other therapies. And that works really well for that. Or they may need, if the disc herniation is severe enough, they may need an actual cortisone injection into their back, and I will refer out for that. to an orthopedist. So most of the time what I'm using, instead of cortisone injections that actually break down the joint tissue, shut down the immunology like we discussed, and degrade the entire structure. So they break down that entire joint, leaving your joint unhealthy, degraded, full of arthritis. And the more you get those injections, the more that breakdown of that joint happens, and the less stable the joint becomes, and then the more tense the muscles around the joint become. And then that creates chronic tension that's going to give you pain for other reasons. And then we've got to treat that. So it really is a last resort treatment, but it's being used as a first resort treatment. And so what I use instead of cortisone injections is prolotherapy and platelet-rich plasma injections. And sometimes I'll use trigger point injections, which is an intermuscular injection. And sometimes I'll use acupuncture, but it really depends on what that patient is presenting with and how to treat that condition. So I just really wanted to discuss with you today when you should be using cortisone and when you shouldn't be using cortisone, and seeking out other options prior to going that route. And I've heard a lot from patients that when they go in to see the orthopedist, things happen really quickly, and all of a sudden they're getting a cortisone injection, and they didn't really expect to be treated that day. They weren't really sure if that's what they should have done, and once it's done, it's done. So I really want my patients and people who watch these videos to be prepared when they go into an orthopedic office, that they don't have to do anything that day, that they can always say, you know what, I just want to think about what you've told me today, and I want to, decide whether or not this is the best route for me. Walk away. If you want to consult with your doctor or you're a patient of mine and you want to come in and have a chat about that pain issue before you get treatments with the orthopedist to see if that's actually what's best for you, that is a really good option, just to always seek a second opinion. And it's what I tell my patients even about things that I'm suggesting. If they're feeling not comfortable about something that I'm suggesting, I say, you're welcome to go, see another person and see what they think about this, because I always want people to feel really comfortable with the path that they're choosing for the rest of their life with their care and their health. And so prolotherapy and PRP work wonderfully for tendinitis or tendinosis issues. They work really well with unstable ankle joints. They work wonderfully for sciatica. Sciatica is a specialty of mine. It's when you get radiating pain from your back through your buttocks down into your ankles. It's one of my favorite things to treat, actually, because there are so many, the treatment out there is so limited, and really it's an ongoing recurrent issue for people who have it. And here I can take care of that permanently most of the time. So I just wanted to give you some ammo as far as what you should be doing next when you have a painful joint. If you're taking ibuprofen longer than 1 or 2 weeks and your pain issue is not going away, or you've been taking over-the-counter pain medications long-term just to deal with your daily life, I would love to chat with you, and you can subscribe to this channel. I'm going to continue to give you lots of valuable information on painful conditions and what we do here at Healing Peak Regenerative Medicine. Thanks for joining us today. And again, if you like this channel, please subscribe. And you can also follow me at Dr. Amber Nixon on Instagram. Thanks so much.